Howdy folks, welcome to another lecture. This one we're going to talk about eye, face, and neck injuries. So let's take a look at the eye. So if you've never looked at the eye, this is a cross-sectional diagram of what it looks like. So this is obviously the outside. This is the colored part of your eye, or the iris. And light actually travels in here, and it comes all the way back here until it hits this membrane here called the retina. It's a hollow globe shape, and I say hollow, but it is filled. It's filled with the vitreous humor here, which is kind of a jelly-like substance that helps, I guess, just probably keep the eyeball from collapsing on itself. Right here, there's actually a little chamber here between the lens and sorry, it's right here. Between the lens and the cornea, there's fluid here as well, and this is the aqueous humor. And it's another fluid, just helps fill the space. So yeah, that's the eye. You've got the optic nerve back here in the blood vessels, so you can see that this whole area of the eye is perfused by these vessels that come in from the brain, and the brain's back over there somewhere. So like I mentioned, the aqueous humor is the watery fluid which occupies the space between the cornea and the lens, and the vitreous humor is a more jelly-like fluid which fills the space between, behind the lens, or the posterior chamber. The conjunctiva, let me go back here, is actually this smooth membrane out here. It covers the sclera, which is really kind of the white part of the eye. So the conjunctiva is just really this outer surface of the sclera. So let's talk about a foreign body. I think every single one of us has probably had at some point in our life some sort of extraocular foreign body. And extraocular, extra means outside, ocular means eye, so it's essentially on the outside of the eye. You have an object on the conjunctiva or the cornea. This is something like an eyelash. Every single one of us has had an eyelash in our eye at some point. Now, people aren't necessarily going to call 911 for that, but it may be something that they were in a collision and they had their eyes open, they felt something fly in, they don't know what it is, maybe it's a piece of glass. So they could have a foreign body just kind of sitting on the outside. A bigger concern though is an intraocular foreign body, and this is where an object has penetrated the cornea or the sclera. Contact lenses are actually a very common foreign body that people intentionally put in their eyes. So fair warning, this presentation makes me squeamish because it has eyeball pictures. I don't really do eyeballs, but here's one. So you can see right here in this picture, you've got an extraocular foreign body right here. You can see the redness, which is one of the signs here. They're going to have a lot of tearing. I don't know pictures of tears, but you can see the eyelashes are all matted here, like they've been tearing up. It may also cause decreased visual acuity, and this partly is due to the increase in fluid in the eye, the eye's trying to get it out, and the iris here will constrict sometimes in response to a foreign body. So what do we do with this? Well, we inspect the conjunctiva. You can actually inspect the surface of the lower eyelid, so pull it down. And there's a way to actually evert the upper eyelid, so basically flip the upper eyelid inside out, and you want to inspect the inner surface of the eyelid as well. If the object is over the sclera or is inside the eyelid, then it's helpful to wash out or gently remove with a cotton tip applicator, a Q-tip. Gently wash the corneal bodies, and you can see the picture here. You want to hold the eye open and basically pour some sterile water, sterile saline. Saline's better if you have it over the eyes. And then you're going to cover both eyes. And the reason that anytime we have an eye injury, we want to cover both eyes is because your eyes move together. So if you only cover the injured eye, it's still going to move around. It's still going to rub against the eyelids because the other eye is going to be looking around. So you cover both eyes. And you're going to transport, and they will evaluate the patient for a possible corneal abrasion. All right, this picture is disgusting. I'm not even going to look at it while I'm recording this. So this is an intraocular foreign body. The signs and symptoms of this one, pain and a foreign body sensation, a possible history of sudden eye pain following an explosion, or some sort of metal on metal near the eyes. So if somebody's doing something involving metal or rubbing metal against metal, there's a possibility that a very sharp fragment could come up and puncture their eye. They'll have some sort of distorted light reflex over the cornea or decreased visual acuity, and they may actually have a peaked pupil. So that means that instead of being nice and round, the pupil, which is a dark spot on the eye, will look more like a teardrop shape. It may be sticking out like in the picture that I'm not looking at, or it may be that you can't really see it. Management here: cover both eyes, avoid pressure. If it's a large object sticking out, then cover it with a cup and transport your patient. Contact lenses. So if somebody's having issues with their contact lenses, don't take them out. You can move them off the cornea onto the sclera, and ensure that the receiving personnel are aware of the contact lens presence. Only wash them out if you have a chemical burns to the eyes. And washing them out, if any of you guys wear contact lenses, you know if you squirt a bunch of water in your eyes, your contacts will actually just come out naturally. So that's just what it means by washing out contact lenses.